Hey everybody, I am stopping in to give an update. I am 5 weeks, 3 days post-op today. It's been about 3 weeks since I uploaded any video update on my progress, and I had my post-op visit with my surgeon today, so I figured today was as good a day as any to give everybody an update on my progress. So since it's been a while, I'm going to go back. I know about 2 weeks in, I let everybody know that I had attempted to go back to work, and I did officially go back to work. Not to the extent of working full time like I was before surgery, but I did slowly kind of ease myself back in to working, and even working some full days 2 weeks after surgery. So I felt strong enough, and my pain was managed well. I just really eased myself back into it with some short work days, making sure that I wasn't carrying anything too heavy, not on my feet for too long, that sort of thing, and just kind of eased myself back into a work schedule that, I felt like I could handle. So I've been doing that since, 2 weeks post-op, and some days I have worked pretty close to full days. More recently, I did kind of test my limits with some weight of a couple of items. Again, even though I felt like I could potentially carry more heavy weight than I allowed myself, I just kind of, tested the waters, so to speak, with that. And there was no bleeding, no significant pain or anything like that. So my assumption was that I was doing okay, and to just kind of keep moving the way I've been moving since week 2 and listen to my body. So that's what I've been doing over the past several weeks. I did have some symptoms that were what I would describe. Some people might, find it more painful. For me, my pain tolerance is, I think kind of high. But the incisions, they look great. They look like way better than I had anticipated. I did have a couple of incisions, and even the navel incision where it looked like there was still some stitches present there. I just left it alone. But as far as healing, I haven't had any, signs of infection or redness, swelling, inflammation, no bleeding, nothing like that. So I felt like they look great. They must be doing great. And those incisions that you see externally are so tiny, and as I learned today, can be so deceiving. So I did have some, mild burning, stinging that would come and go. I had, especially after going back to work and maybe spending some time on my feet or like in and out of the car, and your core is engaged. You don't realize how much your core is engaged in everyday activities, especially if you're an active person and you're on your feet. But I mean, it really tests those muscles and strains those muscles, just everyday normal stuff. So by the end of my days, especially days where I was active or was working, I felt like I'm going much lighter, much easier on myself than I normally would. It's about as easy as I felt comfortable going with my body, without just feeling super stagnant. And so, I had been told, walking, as soon as you felt like walking, make sure you do it. So I'm like, yes, I'm doing this. But I would get the burning and the stinging around the incisions. My muscles in my abdomen would, feel, ache and feel tender. Sometimes if I did work extended hours, and even if I didn't work, if I was just, up and down on my feet and not laying around, I would get I have some swelling and some tenderness that still happens in my lower abdomen. And, I would try to wear jeans and that wouldn't fare well because I would end up unbuttoning or just being uncomfortable altogether and going back to the soft because it did, hurt enough that it was uncomfortable, especially with the fluid retention, the swelling. So I also had a weird thing happen, and I did not clarify this with my doctor today just because it has gone away since. But for several weeks, I was getting tingling, almost like when your arm falls asleep, or I don't know. It just kind of like tingling feeling in my arms. Sometimes they would like go numb, and then I would my hands would get very, very cold, and then the tips of my fingers would be white where the blood circulation wasn't reaching all the way to the bottom of the tips of my fingers. So definitely some circulation issues or maybe some nerve, something going on there that went on for several weeks, and thankfully that stopped. But I did have and continue to have extreme, not extreme, but a lot of pain, like very, very tender to the touch in my hips and down my thighs. So, I also read that, okay, well, that could be, temporary, or it could be long-term nerve damage from, the surgery. So, it feels just bruised, like constant. There's no visible bruising or anything like that, but it is so, so tender. And, if you just touch it, just, kind of very light pressure, it just feels like significant bruising with no bruising actually present. So that is something that I asked my doctor about today. So I would say spotting and bleeding was always really, really light for me. Between weeks 3 and 4, I noticed for a couple of days an increase in the spotting. I wouldn't say it was significant bleeding. It was just a slight increase in what I had been seeing. And I know that as your internal stitches dissolve, that is common to see, to have some more bleeding present. That lasted for a couple of days and then resolved. And now I haven't, for probably the past week and a half, I haven't had any bleeding whatsoever. I have experienced low energy some days, days of where just the least little bit of activity, or even like next to no activity, I still feel wiped out for, it just doesn't match up the level of activity and how wiped out I will feel. Also, very, very common, very normal, as per all of the reading and feedback from women who have gone through this before. And that's just your body trying to recover from the surgery, and it can last for months. Lately, I have had an increase in anxiety and depression. I do struggle with that, just in my normal life. Periods of that kind of come and go. It's been a long time since I've required any kind of, help via medications or anything like that. So it is something that I did want to address because I have noticed, I pay really close attention. I've noticed kind of an uptick in my level of anxiety and the depression that I'm feeling, and sometimes being on the verge of tears and like, okay, is this something that I need to address? Is this, possible hormonal changes, even though my ovaries are intact, So it was something that I definitely wanted to discuss with my surgeon today. So that has been pretty much the past several weeks. Um, so carrying up to my appointment today with my surgeon, um, he was quick to inform me after finding out that I went back to what I thought was really light duty after 2 weeks of surgery, that I took on way too much, way too fast. And thankfully, my level of activity has not done any actual, damage or anything to any of the incisions or the vaginal cuff. So nothing to that degree, but it has certainly slowed my recovery process. Just, trying to go back to some level of, what felt, more normal activity for me too quickly. So if you ask me, I would say, well, I haven't been doing normal activity. I haven't been lifting, a lot of weight. I haven't been, not running. I'm not jogging. I'm not doing all of these things. You said walk, so I'm walking, and he told me there's a difference in taking a light stroll and walking with a purpose. And so the swelling that I'm experiencing in my abdomen and stuff, that has to do with just, the fluid retention that's happening from my body trying to recover internally from, the body parts that were removed, and the trauma of the surgery to my body, and all of those things. So I'm experiencing some fluid retention, some swelling. My cortisol levels are very likely still high, which can in turn lead to feelings of anxiety and depression and all those things. So that being said, I did have some swelling in my nether regions today. So he could physically see swelling present. And the stitches look good with the vaginal cuff. They are still there, so they have not fully dissolved, and that can take 8 to 12 weeks. For them to dissolve. So everything looks pretty normal for the stage of recovery that I'm at. But some of the symptoms that I'm experiencing definitely lets him know that I'm trying to do too much too fast. And he informed me today that I have set myself back several weeks, very likely, from making, a full recovery and feeling more like myself as far as energy levels, not experiencing the swelling, not experiencing the nerve pain and all of those things that I'm experiencing. It's just slowed that healing down. And so he strongly recommended that I take a step back and slow it down. That's tough. That's really tough. Because it just is. It just is. Not what I wanted to hear. I am grateful that, the incisions, look good, that I haven't torn anything or anything like that, but I'm just so ready to feel some semblance of normal and feel my normal level of energy and strength and endurance. I'm just ready to feel like myself again. And it's so depressing to feel like you can't move your body the way you're used to being able to move your body. And, looking at the incisions on the outside, like I said, has been so deceptive because, I think anybody that looks at them, they're like, ugh, that's nothing, you're good. But the trauma from the surgery internally to your body, and the recovery that's, required there, the amount of time that's actually required for your body to heal from that, it's much more than what it appears. So, having to learn that the hard way. So I honestly can't tell you what I'm going to do. I mean, if I'm being 1000% honest in this video, I will likely continue to work because I feel like at this point I have to weigh my mental and emotional health and, the pace of my recovery against one another and decide which one I need to pay more attention to. So I'm still going light when I do work. I haven't torn anything. I'm just really experiencing some more annoyances than, what I would say like something that would contribute to real damage. So, um, I don't, I don't know what I'm gonna do. I'm probably gonna keep working and just try to maybe go a little slower or something. I don't know, but that's what I've been told. So I'll keep you guys updated. So as of right now, I am adhering to all guidelines for as far as vaginal intercourse, that sort of thing. Abstaining from that. And definitely not running, not jogging. I haven't done, I do like some light stretches and things like that, but I'm not doing any significant exercise outside of just normal movement of my body, walking, and that sort of thing. I was prescribed, I can't even pronounce it. It's like Gabapentin or something along those lines. I'll put it in the notes when I upload this video. But he said that I need to take that twice a day to help with the nerve pain that I'm feeling in my legs. And he did strongly advise that even though, because I'm not one to take medication, if I don't feel like I absolutely need it, I don't see the point. But he said the ibuprofen, taking that is more, there's more to that than just like if you just feel pain or I should have been taking that pretty regularly to help with the fluid retention, the inflammation, and things that are going on in my body so that I would feel better. So I am going to go back to taking the ibuprofen. I'm going to take the medication for the nerve pain that was prescribed to me today. He said to take that for maybe 2 to 3 weeks. And we'll see how it goes. So all in all, I think it was a good update. I mean, it's way worse things that, I could have, done something to, tear or, really rip some incisions open or tear my vaginal cuff or something like that. And, all of that is intact and healing really well. So I'm super pleased to hear that. Not so pleased to hear that you need to slow down because it's not what I want to hear. But there it is. So I think that's all I got for today. I'll get this uploaded to YouTube for everybody and post a link on Facebook, and I will drop the name of the medication I've been prescribed in the description. So, all right. Have a good day, everybody.